Sorry for the wait. Yeah. Sorry, we were trying to get fitted with the microphone. So a slight delay there, but panel is just coming. So thanks to everyone for joining us today. Merci à tout le monde d'être venu.
Thank you very much for joining us today. We have a full house. Thank you very much. We're extremely pleased to start off this conference and to continue, rather, with our panel. We have Blair White,
Newfoundland and Labrador, Paul McDonald, Vice President, Programs and Technology at eHealth Saskatchewan, and Shannon Malvek, Executive Vice President, Provincial Digital Health Information Services at PHSA BC. So thank you for being with me today. We're gonna have a more of a conversational approach to this segment. I'll get it started with some questions, and then I'll invite you sort of to join in. There'll be some of our Infoway folks as well helping out. If you have a question, just try to approach it a little bit, and then we'll have the panel answer those. So, s'il vous plaît, alors tantôt je veux.
So I'll be opening up the Q&A a little bit later on for our participants. So we're going to start with a few questions to start off the session.
The title of the session is Modernizing the Health System Through Connected Care. Why don't we start with a little bit of your views on what that means for your province, and sort of like what's the vision behind that and the transformation that you're trying to pursue. I don't know if you want to start.
Sure, I'll start.
Okay.
I don't think this is on. It is on? Oh, there we go. Okay, we're jumping right in, connected care. I'll maybe start and describe it from a clinical and a care setting, because we use the word connected care a lot on the clinical side, but also on the digital side, with some slight nuances. One, from an overall care perspective at a system level, we're really looking at clinical care by how we can continue to promote interdisciplinary teams, how we can attach patients that are unattached to care providers, how we can ensure longitudinal care records are in place, opposed to a lot of the episodic care that we're starting to see. So we're really looking at how we can continue to promote that connected care by that interdisciplinary longitudinal perspective. From a digital health perspective, we have a new strategy and a new vision to create a connected health system that is secure and trusted by all users, clinicians and patients and citizens, and help address our overall population health needs. And in that strategy, we have a new initiative, which we call our Connected Health System. So we've started to use the term connected health system to refer to a number of things, but essentially it's our new terminology for what wasn't landing, and that was the term interoperability and information exchange. So we're really focused on establishing a connected health system, and in that we have three aims. One is to promote that seamless and secure sharing of clinical data to really support seamless transitions in care. The second is to empower citizens to be active participants in their own health, so that they have access to their health information and health services. And the third is to create a better provider experience. One that helps reduce the administrative burden that they're feeling right now, having to work in their EMR, having to go out to different sources to find forms, having to fax still. They're working in such a hybrid environment that it is taking more of their time up. And so how can we look at this information exchange in an integrated way for them, so that it really helps to reduce their administrative burden and allow them to get back to doing what they do best, providing good quality care.
Thank you. Paul?
Great, thanks. Very similar to what Shannon indicated in Saskatchewan, really from the clinical side. Very much the connected care strategy that we have in place that we're trying to build is really trying to get a variety of different clinicians, healthcare providers, working more collaboratively together. When it comes to the digital health side, is how do we enable that to happen? So lots of initiatives that we were looking at pre-pandemic, and then obviously post-pandemic, a variety of those things slightly changed as part of that. So a lot of focus around the virtual care. In Saskatchewan, obviously with our remote and rural communities, it's been a challenge to get healthcare providers in those communities to provide the care that they're accustomed to have. So we've been looking at leveraging virtual care within the ERs predominantly, and leveraging that in the past 3 to 4 months to try to help that. The other big piece we're really exploring and trying to work on quite a bit more is obviously going through the pandemic. You know, we have around 60% of our citizens have access to their health records through our patient portal. So it's about enabling further optimization of that tool. We really believe citizens are a key participant is in the interoperability, not only sharing within the province of Saskatchewan, but across jurisdictions. We want to find ways to enable their ability to access that information and share it across, you know, not only in Canada, but around the world. So looking at trying to drive some of those standards and pieces is really important. We're also, you know, obviously doing similar things with healthcare providers, trying to enable the same types of technologies. In Saskatchewan, we have a little bit more centralized management of the information and the systems around, though we have a lot of work still to do. We have the ability to share that information a little bit easier than maybe some other jurisdictions. So overall, those are kind of our core pillars. The last one I touch on is really, you know, in the last 3 years, we put aside a lot of the scheduled things that we were planning on doing, obviously, to support the pandemic, and a lot of great things came out of the pandemic. The con of that was obviously there was a lot of legacy systems, technology, information flow that we didn't touch. So we also have an increased demand right now on dealing with a lot of that legacy technology, legacy challenges that we have. Faxing, I can't believe we're still talking about it, but it's still prevalent. And so a lot of those things we need to get back to and obviously modernize, you know, not only the health system, but the technology that supports it. And the last piece I would say is there's a big push in Saskatchewan to, you know, find a way to, you know, enable the system to have more readily access to information and technology. 10 years ago, you could get by with without having technology. Today, you can't. So I think there's a large change in the climate to say, how do we make sure that we go out and actually support the core technology, the digital health, because it's now a key tool in delivering the care to the system.
Thank you. It's a very similar journey, I think, throughout most of the country, and it'll be a little bit repetitive. Out east in Newfoundland, we had a health accord plan put together, which reimagined a bit of how we deliver healthcare, and it's really pushed our boundaries out into the social services side. I think everyone in the room has heard that we need to get at social determinants of data, but this plan has really pushed us out into that area. So that brings a whole new element to us in terms of technology and data, like how do we get to that data and get it in front of patients and caregivers. So that's, you know, it's a social side of things is pushing us, and then the overall foundation of just access to care. So those are the two main pillars that we're working towards. And then as you bring that down, how do we enable the citizens of our province to have digital access to our care? So some of the provider focus is, some of the citizen focus is really how do they see the various care settings the same? So as you know, they could be going to a pharmacy one day, they could be going to a family doc one day, could be any type of social services they're receiving all the way in through health into the acute care. So we have a challenge to connect our citizens to the system digitally, and how do they see it simplified? And that will be a bit of a change management exercise as we go out into the citizens. And then on the provider journey, like most provinces, collaborative teams are really being expanded in our province. And the social side of that, the social services are being added to that collaborative clinic in concept. So we obviously need to be able to staff these things. It's a new challenge that we all have as a country, is how do we staff these clinical settings? And then how do we connect that collaborative team clinic as being the first point of access to the health system? How do we connect that in through the various other services? Infoway is obviously enabling the country to connect to retail pharmacies, and then how do we connect everybody into referral patterns, laboratory orders, DI orders. How do we connect that seamlessly through the data? And so that will be a bit of a journey. Since the pandemic has obviously enabled us to do many of these things, and the citizens of our province are really pushing us, which is a new push. We've had providers pushing us for many years, and now the citizens are really pushing and demanding this to us, helping us. And virtual care is certainly a key enabler that we see to help us. We, as similar as mentioned earlier, we have a very geographically rural area, and we have many citizens living in rural areas. So we need to be able to digitally and virtually enable them, and that brings some challenges that we need to overcome. Equity becomes an issue as we go rural. It can be an issue in our cities, but certainly as we go rural, it becomes an issue that we're grappling with. How do we ensure that the virtual and digital world can work all throughout our province, all the way to northern Labrador? So it's similar to most provinces. We have a bit of an equity challenge there, but we do have a key opportunity for most people in this room. We're in the data world, in the tech world. Our health system is driving us to have more information in front of providers, have more information in front of the citizens, take the demands off our emergency rooms, take our demands off the collaborative team clinics. Can we keep our citizens at home as much as we can? Can we keep them in the long-term care facilities versus transporting them all the time? So it's a fascinating time to be in the industry. There's certainly some challenges in front of us, but it's a fascinating time to realize our side of the healthcare system is being seen as a key enabler. It certainly has always been seen, but I think it's at an all-time bust right now, is being seen as an enabler to help the access to care in our province and probably our country.
Excellent. Bon, je vais poser la question en français, après en anglais.
I will ask a question in French and then in English. Of course, we're looking at a very complex transformation with many dimensions. Can you talk about your priorities and how you initiate this transformation?
There's many dimensions to this. Can you sort of like share with us sort of like your highest priority, or sort of like the key problems that you're trying to address first in trying to mobilize this transformation? And maybe Paul, I can ask you to start.
Sure. I think our biggest challenge, and not just from digital health, obviously from the broader province and the healthcare system, is our challenge with labor shortages, both from healthcare providers, but also from our digital health or information technology. We're obviously challenged with getting talent in, and obviously just getting folks in to do a bunch of the normal things that we did pre-pandemic. It's quite challenging right now for us. So, getting some of that sorted through a variety of different strategies in Saskatchewan. I know we've set up a new agency to help us do that for recruitment. We're also looking at broader strategies, around the world on how we can attract talent, and I'm sure everybody here is in kind of a similar boat. So that's probably one. Obviously the age-old adage is how to drive better information flow, not only throughout the province, but through different jurisdictions. I know Blair just mentioned, and I think I talked about it a little bit, as we went down the journey of providing access to our citizens, they started seeing the information, and now their demands for what they want and what they see is huge. So that's pushing a lot of transformation, and how do we get more information to the citizens? How do we get the exact same information at the same time that our providers see it to our citizens as well, and connect it? We're obviously seeing really great success in not only in outcomes for citizens and patients, but obviously the collaboration with providers has also been very successful. And then the lastly is really around that remote and rural access to healthcare in Saskatchewan. So, trying to drive some of that ED stabilization through leveraging virtual care and some of those other things has been very difficult for Saskatchewan, in making sure that we can keep all those rural and northern communities with access to physicians and other healthcare providers.
Sure. To add to that, I mean, you touched on it at the beginning. I think we're all finding the most pressing problem right now is HHR availability. I think in BC we're still tracking the highest unattached rate of patients to primary care providers than the rest of the country. So major challenge. You've been likely seen in the media. We've been tackling the primary care problem quite actively over the last couple months. Making good progress, but a lot still to be done. We did some deep engagement over the spring and the summer, and then Doctors of BC did another survey this fall, and it really shone a light on the need for us to focus on information exchange and just the disconnectedness across the system that is contributing to our overall HHR challenge. I touched on, the hybrid environment that clinicians are feeling in their everyday, practice. Then we layered on a ton of tools through the pandemic: virtual visit solutions, secure messaging, more forms, e-signatures. And we created such a disconnected experience for them. Then you think about, episodic virtual care providers that have popped up. Some, we lost providers to that, and then we don't have that information connected back into the system. So we're really looking at how we can solution that. Then you look across the system, and all of our transitions in care are still completely paper-based. You touched on the fax machine. When a patient in their primary care office needs to be referred for a cancer screening, referral is sent by paper today. Well, how long does that take? How long, where is it? Then they eventually get in for their cancer screening, and those results are then sent back manually. So such a pressing problem for us to look at how we can really support information exchange, connection of information to lead to a better experience, providing that information to both the providers and to the patients, as Paul mentioned, and really look at ways to help improve that experience so that we can help address the HHR challenge that we have, because we know that we can't just hire more resources. So.
Blair, I don't know if you can maybe talk also a little bit about, is technology, are there some early wins on the technology side or on the regulation side? Just sort of like give us a bit of a sense of how do you sort of like get going on this journey. That'd be great.
Yeah, sure. I think we all have the same job every day by the sounds of the same problems, but it's founded in the access to care is the root problem, and technology is being looked upon as a way to really assist with this issue that we have. Virtual care has always been kicking around. Telemedicine has been around in our industry for a long time, but it is at a pace now that we're trying to catch up to, really. There's certainly a belief, and a strong belief in our industry, that the virtual care can help with access to primary care and overlapped with access to emergency rooms. Both of those issues are prime in our province, and they're looking at digital for the virtual side of things to be able to enable that appointment, which is fairly a straightforward process. Change management is certainly, Shannon mentioned it, this is a challenge today with our providers and our citizens. The change management around the technology is complex and takes a little bit of time. And the information flow is certainly being driven much more than ever. Can all the primary care providers electronically order, and how come they can't get the results back? 811, the 811 phone number has become a really important piece of data in our system. Our acute care providers are looking for that data to be available to them instantly, and they're also looking to get more information at our 811. So that's another area that's really expanded to see as a way to help the access issue. And also over on the administrative side of things, there's a real push for data about the HHR staffing situation. And so it's driving us over into technology in that area as well. How many people are supposed to be working here, and how many do we have today, and how is the recruitment going? So there's a lot of focus over in that area as well for us right now. For years we've been focused on providers and engaging with the patients. Now there's a big administrative push to get some technology around the the recruitment process, as well as, you know, the HHR issue that we all have. So it's a whole new area, but there's a lot of work going on over there as well. So in the Access and the HHR, they're both looking to digital and data for solutions. So it's a really great opportunity. Brings some complex challenges. It certainly wants to be stood up quickly. And when there's a significant change management task ahead of all of us when it comes to those things.
Excellent. Donc, on peut peut-être explorer.
There are many similarities in what you're saying and in your visions. Are there any opportunities for collaboration at a pan-Canadian level or between jurisdictions?
Challenges that you have, and even sort of like the vision, right? It's, you know, we're hearing through your words. So do you see opportunities for cross-jurisdictional pan-Canadian collaboration? And you talk a little bit about that, you know, and sort of like what could be done differently moving forward, or what can we build on that maybe it's already happening? So I don't know, Shannon, I'm going to ask you to start.
Sure. Yeah. I mean, just listening to both of you talk, like we're dealing with the same exact problems. You know, likewise, we're looking at our HR processes and solutions that we can put in place to help figure out where we have gaps in talent that we need to address, and how do we improve recruiting processes. You know, likewise, looking at getting this data to patients, we definitely see that we have the similar strategies, and so collaboration across us is so key. Forums like this are amazing for us to, you know, to have our teams connect, to connect together, and then to take that, you know, as we leave. I think back to the September session where Infoway had an event, and we had a Digital Health Canada chief event, and we shared our digital health strategies across the country, and they were all very similar, and we established some great connections that we're still following up on. And so the more we can do that, I think it helps us. We also we're about 2 to 3 years into an FTP table of digital and virtual health, which is accountable into our Canadian deputy ministers. And it's a place where we want to ensure some collaboration across the country, but a specific look at our common challenges and some of the common aims that we have around interoperability and data standards, and that's leading to a lot of the work that I think you'll hear throughout the next couple days that Infoway and Kai are helping us do. So agree, we're tackling similar things. And so how can we share, and not just technology solutions, but how can we, you know, share approaches to architecture, approaches to standards, procurement. You know, our BC team's in great conversation with Philippe's Quebec team around implementation methodologies and clinical and business processes. So it's much more than just the technology solutions, but definitely, you know, encourage us all to have and build those collaborative relationships.
And I think I would just, you know, I agree with everything that Shannon said, and very similar to what we see in Saskatchewan. I would just add on, I think, you know, going through the pandemic and now providing such large access to information to citizens is basically put on the forefront of how do you share that information across these jurisdictions. It was there before. I know providers struggle with this challenge, always have, but I really think there's a big push now, you know, a challenge for all of us to figure out how do we allow that information to be shared more easily across jurisdictions, and not just only with Canada, right? You know, our citizens travel lots of places in the world, and they want to be able to have that access and that information, whether they're getting an MRI in Florida and they're coming back to Saskatchewan for care, or a variety of other situations. So, you know, I think there's a real need to figure out, you know, how do we create common standards and the ability to share that information. I know in Saskatchewan we see it as a good opportunity to find a way to, you know, have the patient, the citizen, through some of that technology, having that ability to share that information or be the key conduit of consuming and sharing their information no matter where they go. And also looking at, you know, similar from the provider side, how do we enable that? And we've done some really good work in doing that with different provinces, obviously Alberta and Manitoba, next to Saskatchewan. So there's been good pieces. We just probably as a country need to focus a little bit more around how do we bring down some of the traditional legislation, privacy challenges that we all face. They can be overcome. It will take some time, but I think that's a key thing that a lot of jurisdictions need to focus some time around. And I think there's an openness, obviously, from all the different jurisdictions to do that. And then I would just go down back to what Shannon said, the processes, the standard, the compliance portions that we can come together and really set the stage to allow for that more interoperability or information flow to happen throughout Canada, and I would say probably, hopefully, around the world as well.
Yeah, thanks. I won't repeat much of that. We believe that, and Infoway has helped us see how we need to collaborate as a country. Infoway has done the research around the successful countries, and with the collaboration for all the things that has been already outlined, and us implementing this correctly across our country. The next wave, it's not a next wave, it's there already. It's the citizen at home with endless devices and hooked to them or in their house that will be transmitting data. And these are the big hitter vendors of the country, of the world really, and they want to know what is the Canadian standard for moving the data so that any of us can help the clinicians plug them in and work. And then all the way through to the acute care setting of the AI is coming. It's here in some places, but it's certainly early days, and they require data, and the data needs to be fairly standardized, for that to work. All the way through to robots in operating rooms are kicking out data now, and so all these things need. The theme of this discussion is connected care. So everything from the IoT at someone's home through to an operating room needs to be connected, and without us doing this together and creating the national standards, we won't achieve the desired outcomes. We'll achieve some outcomes, but we won't achieve the desired outcomes that we're all aiming for.
Excellent. Bon, je vous invite
So I would invite the floor now to ask their questions. I have more, but I would like to engage the room into this discussion.
Point. I think I still have some more questions for the panel, but it'd be great to have some of your questions as well. So who would like to get started? All right. Okay.
You talked a lot, Blair, about the admin. So is it something that you'd like to clear, to better process the admin, and then concentrate that budget that you'll gain into the patient care? Because you talked a lot about the processes and business process.
On the HHR side?
On the healthcare, but I mean for the admin side.
Yeah, reducing the administrative burden, and can that essentially translate into savings that can be reinvested? That's what I'm understanding your question to be, right?
Ça fait, c'est ça. Merci de m'aider.
Thank you very much for helping me make sense.
Now it's a very acute scenario I was trying to outline, a very acute scenario of, how many providers do we have in that community, and how many providers are supposed to be in that community at the clinic, and can we keep it open 18 hours versus 6 hours? So that's where we are. It's pretty acute right now. Emergency rooms are driving this. Emergency rooms around rural areas are scheduled to be open so many hours. So it's a very acute. We're not that far in our journey to that, what you outlined.
Yeah, it's actually a measure that we're looking at in BC. We have a theory that if we reduce the administrative burden that providers are experiencing, particularly in primary care where we're focused right now, that they will be able to see more patients. Highest unattach rate, we're really looking at strategies to get more patients seen. And so one of our strategies is to really look at that provider experience and the workflow in their practice. And we believe that if we can shave time off of what has caused them much more, longer times to chart and to process paper and be in their EMR, that they can then get back to seeing more patients. So it is something that we'll actively measure as we go forward.
Yeah, I would just add, I think from Saskatchewan, you know, a lot of our providers have hit it on the head by really indicating, you know, they need that information. When they can get, you know, the interoperability information from our acute sites to our primary care sites to our long-term care sites and everything in between, there are obviously the outcomes for the patients are higher, and we've done some studies around that, which are you know, kind of confirm, I think, what we all knew. So, you know, the administration burden is a challenge for healthcare providers, and it is one that needs to be lessened. And I think there's a lot of great technology out there and a lot of great enablers, but there's also a lot of, you know, challenges around workflows and changes. And, you know, in Saskatchewan, we've recently, it's been 4 years, where we, you know, created one health authority, one or a couple organizations to manage all the healthcare. And I think that journey of trying to do that in the province, where we break down all the regional barriers and the information flow challenges, you know, we're not as far as we want to be, but I think doing that, we've seen some real benefits, you know, when we can take, you know, 12 disparate, you know, lab systems or DI systems and move them together and have a real strong ability to share that information. We've seen that administrative burden lessen on providers, and it makes their job quite a bit easier. You know, the age-old adage I hear from providers is, you know, how many different access or logins do I have to do, and how many different clicks, right? So trying to lessen that, and there's real, you know, evidence around that. You know, if you have to log into 8 different systems, you have to click thousands of buttons. I mean, that's essentially waste that could be provided for care. So there's a lot of opportunities, and we've seen that through, you know, transcription technologies and others, where it's really significantly reduced that administrative burden.
Excellent. Voilà, je vois qu'il y a une deuxième question.
I see there's another question.
There is already innovation out there that is available and solutions that are available, and they're deployed around the world, whether it's in the UK or Australia or the Netherlands and other countries. I feel that there's a lot of collaboration between the industry and the healthcare system, up to the point where procurement becomes involved. It seems to be that there's a lag there, and I was just wondering, how are you addressing the procurement cycle? Like, we see, like, sometimes an RFP that will take, for, let's say, interoperability engine, takes a year to be drafted. Then the process drags on, takes 3 years to replace an engine, where, you know, the technology is there, it's available, it's easy, it shouldn't be that complicated. And that's just a simple example of some of the challenges that the industry is facing when trying to help you and collaborate.
Sure, I can start. There's no doubt, you know, our different or differing procurement requirements and approaches in Canada is a challenge. There's no doubt. I think we all struggle with components of it. I mean, I was just on a call yesterday on a similar thing, you know, trying to figure out, you know, what are all the different procurement requirements, legislation requirements throughout different agreements that we've signed in Saskatchewan, and it's very complicated and challenging. On the flip side, though, I think we've seen some good collaboration between different provinces through Infoway as well, where we've come together and done kind of a joint procurement approach on a variety of different tools and techniques, and I think we've done a couple of those, and they've actually went quite well, and took quite a bit of the burden necessarily off each different province that had to do it. So I think there is a lot of opportunities, but it is definitely a challenge. I would kind of, you know, procurement would kind of be in the same, and I'm not talking that it's not important, because it is very important. Even the privacy and the security components, all those need to be looked at and find a better way, you know, not only probably more focused in Canada, how we can kind of streamline those or leverage those together so that we don't all need to be going and doing 10 RFPs or 13 RFPs on similar types. Could we leverage each other's procurement requirements around there? So
yeah, just echo, Infoway has helped us with some of the procurement processes themselves, and then also the work we're trying to do collaboratively together. Like, I know it mightn't be excited all the time, but what is the standard? What is the interoperability that we're going to create? The International Patient Summary is an example. Like if we can agree to these things as a country and these get placed into our procurement processes, I think it helps with that process as well. Like right now it could be every hospital bed is rated a different requirement. Every hospital, if we can do these things, the interoperability work, I think, is the key to helping us with this stuff.
Thanks. So we have another question on this side of the room, and then we'll go next.
Thank you. So I'm a health advisor patient advisor from BC, and healthcare data interoperability, I think, really empowers patients in their care, but even more importantly, increases the quality and safety of the care they receive. And I am linked up with the Health Gateway, and I wondered if Shannon wanted to talk more about what is available on it and what's coming next. Thank you.
Sure, yeah. For those that don't know our Health Gateway, thank you for the opportunity to highlight it. It is our provincial portal for our citizens in BC, and we have been putting a number of provincial sources of information, labs, medications, right now working on diagnostic images, immunizations out, similar to the other portals that we see. We also have a number of health authority portals in our province. They've been there for some time, and we recently made the decision and announced to our sector that we will move to one comprehensive provincial portal solution. Doesn't necessarily mean that it will be one technology, but we really want to create a common and a consistent citizen experience. So they're not having to go, to different places for finding their health information if they ended up going into the hospital. Likewise, we're taking a very similar approach to virtual care solutions that we have. So we're in the process of further building out the roadmap for our Health Gateway, adding additional sources of health information into it. We also have had a whole lot of experience in BC with citizen booking, the COVID vaccine, and the ability to text citizens when they're due for their booster or to get an email. Has been a great solution for us that we've now expanded into flu. It's the first time we've ever documented flu ever consistently in the province, and then given citizens their records in an electronic way. So we're really looking at how these booking services that we're expanding out, because we're not going to stop at flu now, can link up with the Health Gateway to create that better citizen, common, consistent experience.
Paul or Blair, do you want to comment a little bit on that as well in terms of what things that you may want to highlight?
Yeah, I mean, I'll just touch on, Saskatchewan. We deployed, it's coming close to 4 years, our provincial patient portal, My SAS Health Record. And we initially came out of the gate with 5 sources, clinical encounters, DI reports, pathology lab, medications, immunizations was our kind of product offering that we did. And it's been great success. I think we're just shy of 60% of the population in Saskatchewan have access to it, and it was a great tool, obviously, throughout the pandemic. We're really focused around, obviously adding further things. We did our proof of vaccination through the patient portal, and we're looking at doing similar things, bookings. It's really the kind of one-stop shop for patients in the province. That's where we really want them to go to access everything from virtual visits to, scheduling appointments to health information. It's kind of that piece. We're also focused to other pieces around is obviously self-entered information. So citizens can enter information that they have, a variety of their devices, whether they're diabetic or a variety of other use cases. Imaging reports from Newfoundland, they can put those in, and we're actually enabling it to then become part of the electronic health record, which then obviously feeds back to all the acute EMRs and primary healthcare EMRs in the province. So we're really trying to leverage that piece as well, and we're actually just working on deploying out all our transcribe reports. So there's about 90 different provincial reports in the province that are being done, discharge summaries to a variety of others, that we're trying to put all that information and make it available. You know, hopefully in the next 6 to 9 months, we'll be able to go through that journey as well.
Sure. I wish I could teleport Danielle up next to me. Danielle is in this room here somewhere and knows this file inside and out. So Danielle, I'll give it a go. Like most provinces, we stood up for COVID. We stood up your immunization record, appointment bookings to get your immunizations. They were quite successful. We have, in certain areas of our province, you can book blood collection, and it's been extremely a big hit. And now we have we're on the vision now to release, similar to Saskatchewan and BC, the lab results will be released, as well as the medical imaging results will be released, and some of the community medications will be the next step of the journey, and that'll be early in 2023, thanks to the help of Infoway. And in terms of collaboration, we're continuously talking with the Saskatchewan team, the BC team, the Alberta team, like, you know, what were the lessons learned as you went down this journey, because it's it sounds great, but there are some complexities underneath the hood. There is some change management, and there are some significant decisions that need to be made on these journeys as we go along. And we certainly envision, like, the concepts of RPM programming is going to keep to grow, especially in the chronic disease area. That's an area that's really going to expand. And then, as Paul outlined, we'll get on the journey of patients being able to input their data that they can collect at home. So it is a key area that we're down the road right now, and it's actually giving us a lot of momentum right now with moving the technology forward, engaging the citizens into healthcare as a whole. Like, they want to get access to the referral patterns. So there's a long journey down the road, but it's really exciting right now.
Yes. What is your province strategy to use connected care to monitor and reduce gas emission waste of resources?
I don't have the answer. We're actively building our sustainability plan right now. So I'd say it's an integrated part of our strategy. It's an action plan that we're developing across all of the government of BC, and we're definitely looking at how digital can play a role. And absolutely, we have targets there around virtual care and how that can that can support keeping patients in their home. Likewise with home monitoring. We're looking at the concept of hospital at home and early discharge, or even the concept of still receiving acute care, but doing so from your own home. So you're an active patient within the hospital, but you're in your home. Of course, those are key initiatives, but we're also building our strategy on how just more information exchange and electronic workflows can support. So more to come.
Yeah, I would say, in Saskatchewan, we're just starting to measure a lot of the, notional benefits of, patients not having to drive long distances, especially in Saskatchewan. And, we've done some initial analysis, obviously with, deferring a lot of visits where people would have to drive long distances, and virtual care and those components. We're looking at that, and there has been we did some large patient surveys around this in conjunction with our patient portal, and there was significant improvement. I can't remember the exact numbers, but 35% where a drive to a clinic or a hospital was deferred because of the information they had, or the visit they had virtually that didn't require a visit. So I think there's a lot of desire to start tracking that a little bit more. So hopefully some of that will have more information that we could share later on.
I'll just elaborate. It's similar in Newfoundland. Like the people with those type of accountabilities are starting to ask questions, so the conversations are beginning, and that is a conversation that will continue to grow.
Good morning. Good morning. My question has to do with the future. We know that we're never going to get caught up. Our technologies are somewhat behind where maybe other countries are. We know that our future generations are going to demand more. They are not going to be satisfied. I'm from BC, so you know the Gateway has a lot of great information in it, but it won't be enough. You know, I think about the millennials and how the information they want access to at their fingertips is different than my generation. And so how are you looking at the work at your tables, because you're all quite influential in your provinces, how are you ensuring that what we're building has some future thinking to it so that we're not always lagging behind? Because I do believe that future generations are going to push us in ways that we haven't seen, and they are going to require us to give them more information. So knowing, you know, privacy and innovation takes time, all of those things. I hope that there is conversation happening that talks about what this should look like in 10 years, 20 years.
I can start off. Absolutely correct. I mean, I think, you know, from what we saw in the, you know, when we look at some of the data from our patient portals and the usage of who's using it and demographics, I mean, obviously, the younger generation is much more in tune to using that technology and much more versed. And I think we're hearing directly from them about what they would like to see. I know in Saskatchewan you know, we've set up some citizen patient engagement sessions to start driving like what types of information, how do you want this to work, and you know, some of the initial pieces or information that we've already received is really around that focus of that, like they want one portal or one place to go. They don't want to be going to 10 different places to get information. They want a nice simple app that's their way in where they can drive. So I think there needs to be that focus. I think the engagement with the citizen needs to be, you know, I think a little bit more in tune to that. I think the challenge really is the legacy systems and the challenges of information flow that we have, and you know, solving those issues so that you can actually get that information. I mean, I've heard from a variety of you know, young physicians to young citizens where, you know, they're just like, you know, why can't I just get this information? Why is it, you know, it's here, why can't we get it there? I think Blair alluded to, there's a lot of change management components that we need to work through, and there's a lot of complexities, obviously, as we can all be attuned to in healthcare, where we have to work through all those. I think the pandemic, you know, the pro of it really showed what you could deliver from a technology, digital health, and how you can actually move things out quite quickly. So I think, you know, the pro of that is, I think a lot of our, you know, our jurisdictions and leadership want to keep moving that forward and driving further changes. I think the broader challenges is moving fast comes with some challenges as well. So, but I agree. I think there needs to be that large focus. I know in Saskatchewan, you know, cementing our kind of digital health strategy, 5, 10, 15-year roadmap, and really kind of focusing on that is a key enabler for us.
I'll add, because I think it's such an important topic for us, and it's one I'd say we're not great at in BC. I imagine we're all dealing with the same you know, similar problems. I mean, I think about our legislation. We're all trying to tackle changes to legislation that is still so old. And we're just starting to tackle that around information sharing. Heck, we can't even get prescribing in BC because we've got 10 to 15-year-old legislation that says we have to integrate with PharmaNet. So, you know, that's the reality. We also have a number of decision makers that actually believe that patient attachment to a primary care physical clinic is what we need. When, you know, maybe the younger generation is completely fine with an app and a symptom checker off their phone, and, you know, press a button and I can get a virtual interaction and get the care that I need. So, you know, we're dealing with that dynamic to try and move things forward. So maybe a call for help in this area. You know, partners out there, help us think about what is to come in the next, you know, 15, 20 years. Show us what's happening, internationally, because we don't have a lot of space in our day to think ahead and to think strategically and to really look at what others are doing. And so maybe a call for help in that area. Thanks for raising it.
I'll just add one little piece. I think the working collaboratively together and the work that Infoway is trying to do to pull us all together is a part of the sustainment journey. If we build them similar, the vendors can, from a pure tech digital side of things, the vendors can keep their products updated. They'll know what they expect, and it gets into the sustainability issue. In my opinion, I think we've learned this from around the countries that this is the way to get into a sustainable digital industry in healthcare.
Good morning. I'm going to start my question with a little bit of a disclosure. I'm a psychiatrist and also a physician who experienced burnout myself, actually before the pandemic, and we know what's happening to physicians subsequent to the pandemic. And I'm also someone who believes in the power of technology and the need particularly to support our family practitioner colleagues who bear the weight of mental health care delivery in this country. And my question for you is, this is an incredible opportunity to ask leaders like yourselves, because what led to my burnout was, multifactorial, of course, but the lack of compassion in our healthcare system. My fear of sending my patient to hospital when I was providing care in the community, how would they be treated? And I wonder if or how, as you're talking about these incredible new technologies, you're considering compassion, the care in healthcare. Is that a consideration? And if it is, how are you considering it? Thank you.
Yeah, this, for our side of things is to bring people like yourself through the journey with us onto the governance, the formal governance committees, the implementation, help us with the change management to bring this perspective to the table is how we tackle that. As Shannon said, the days can get busy and tech can become the solution to something that quite might not be the solution. So, for us, it's to get that input at the table, have people available to us, have the patients at the table, have the providers at the table to ensure we have the full spectrum into this complex problem.
Yeah, great question. Similar to what Blair, indicated, we try to use we bring in folks from a variety of different backgrounds as part of our governance committees to manage those. Couple other things, we've done, or what we've seen is, obviously, we've put a more emphasis on making sure that, from just selfishly the technology side, that, we can provide more, I don't want to say face-to-face, but more, easy access to help when things or issues are happening with technology, rather than being a little more high volume call centers where you can't get in, trying to focus on having actually more of our technology folks embedded in the acute care setting. And in addition, similar to with our citizens and patients. So, obviously when they're having issues, they can call in and get a live person and help them through that journey. So I think with our providers, we've heard is making sure to have those local technology, digital health people embedded at the site provides a better, support mechanism for what's happening. And I think it does drive a little bit more compassion than kind of this, agnostic, cold technology that's going. But I know in Saskatchewan there's a heavy influence on making sure that that compassion is an important part of the care journey, and I think we've all seen pros and cons to it in our different jurisdictions, but it's definitely an important thing and something we probably struggle with, and something that we're eager to find different avenues to support.
Yeah, echo a lot of these comments. Ensuring patients and providers as part of our committees is great. We've also had some really great experience over the pandemic, learning agile methodology, getting out MVPs, multiple releases. and building solutions in partnership. So we have a patient committee that's active in helping us look at how we build releases off our gateway. We have providers that have been helping us build a lot of the new releases and some of our new solutions, and so trying to involve that in the process, has worked for us. I also think just listening is so important. Listening and engaging is key. We just completed very intense months of negotiation around our physician master agreement. And while that was going on, we went deep, myself included, executives from within our Ministry of Health, as well as the team, and we just had conversations and we just listened. And I ended up having, some great one-on-ones with primary care physicians, some that would end the conversation with me with them in tears, talking about how, they just had this intense workload, and then they'd have to go figure out how to do their paperwork at the end of the night, and it would take them 45 minutes to try and figure out how to file 3 different reports that came into them. So just listening, I think, is very important for us to do, and making that space for for that engagement, and I think that helps to ensure that we think about compassion in what we're doing.
Thank you very much. Merci, vraiment, c'était.
Thank you for these excellent comments. Thank you to our panelists, and thank you to the audience for your questions. I hope you found it as interesting as I did, and I invite you to continue these conversations.
Big thank you to our panelists. So.